Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson all about IBD and mental health. Now, having good mental health is defined as being in a positive state of mind and body that allows an individual to feel safe, providing them with the ability to cope and be in touch with their environment and other people. Being in a frame of mind that is positive allows us to feel confident within ourselves and comfortable in being able to express our emotions without fear of judgment. This provides a foundation to allow individuals to engage with their environment and surroundings while allowing us to build connections and relationships with others. It involves the feeling of being part of a community, whether professional or social, providing us with the tools to adapt to situations, cope with stress, and live and enjoy life. Living with IBD, which is a lifelong illness, is challenging on all aspects of a person's health, especially their mental health. There are many ways in which IBD can have a negative impact on mental health, as receiving a lifelong diagnosis can trigger a lot of feelings and emotions such as anxiety and fear due to the uncertainty of what the future might hold. It's important to acknowledge how you are feeling about your diagnosis, allowing yourself the space and time you need to process them, knowing that these feelings will eventually subside. Just like everyone's IBD is different, so is the impact of a diagnosis of IBD will have on an individual's mental health. Some can be overwhelmed at how drastically their life has changed or might change due to taking different medications or having surgery, that they experience high levels of stress and anxiety, which can cause them to enter a depressive state. But it's not just receiving an IBD diagnosis that can negatively impact on mental health, but those who have been living with the condition can still be at risk, especially if they are experiencing a flare-up, facing surgery, or if medications have stopped working or experiencing low mood due to fatigue. It has been seen that the presence of psychological comorbidities in IBD, such as anxiety and depression, along with the influence of stress from either a social or professional aspect of an individual's life, can trigger flare-ups. Additionally, dealing with mental health issues due to IBD can increase the risk of a person's neglecting their own physical health by not keeping up with medication, going to appointments, or participating in physical activity. So let's look at anxiety and IBD. Anxiety disorders can be defined as a sense of uncertainness that causes fear and worry about a situation that an individual is unable to control. The severity of anxiety experience will vary between individuals, but it's estimated that up to 40% of those with IBD will experience anxiety. Experiencing anxiety can also be a trigger for flare-ups and a relapse of symptoms due to the connection that exists between the brain and the gut. This causes a change in the intestinal permeability and can cause even more anxiety, as it can bring up feelings of uncertainty, as the person will have to decide on if what they are feeling will eventually subside or may require a visit and admission to hospital. Anxiety can also occur if medications have stopped working and individuals are then faced with having to try different medications. Feelings of anxiousness, fear and uncertainty can occur based on the unknown of taking a new medication, whether it will work and what side effects may be experienced. One of the most obvious causes of anxiety in those with IBD is the availability of toilets, or known as toilet anxiety. The fear of not knowing if there will be easy access to toilet facilities can cause some to avoid or even cancel social events out of the fear of needing the toilet and one not being available. Linked to anxiety is depression. So depression can be defined as a mood disorder that causes the continuous feelings of sadness, emptiness, or irritable moods that changes a person's ability to function to their norm. Those with IBD are at an increased risk of depression due to the unpredictability of the disease, causing them ongoing stress and anxiety. Depression can also be caused due to the disease and symptom reoccurrence, especially if a person was in a period of remission, while it is seen that those with IBD and depression have a higher rate of being admitted to hospital and have more severe disease than those who do not have depression. Body image is also an issue that can impact mental health. Now, body image is defined as a person's view of their own physical appearance, which also includes how their body works or functions. Studies looking at body image dissatisfaction have noted that it is associated with poor mental health, decreased quality of life, and is a topic that is often not given much thought or time during hospital appointments. Body image dissatisfaction can occur due to poor mental health, which can be influenced by social media or photo editing techniques employed to depict what the ideal body type or shape is within the media. These external factors are also relevant to those with IBD. However, there are additional disease-relevant implications that need to be taken note of, which includes the impact of having stomas or surgery scars have on the body, along with the side effects of medications such as corticosteroids, which can cause weight gain. One of the other most common causes of body image dissatisfaction due to IBD is the frustration of how individuals' bodies are not able to do tasks that they used to do before they experienced symptoms or were diagnosed. As mentioned, people with IBD can often undergo surgery, which can result in scars or placement of a stoma that changes an individual's aesthetics, often causing self-consciousness. This, along with medications used to treat IBD, can cause hair loss, weight gain, causing stretch marks, and corticosteroids also are well associated with the moon face appearance, which can bring along feelings of self-consciousness. Despite the exact cause of IBD is still unknown, it is thought that the way we react to environmental and lifestyle factors could be a contributing factor. Because of this, those with IBD can often wonder what it is they've done or what habit they have picked up or something they've encountered in the past that triggered their IBD. And so it's not uncommon for them to feel a sense of self-blame for developing the disease despite it not being their fault. The assigning of causality to events such as a disease diagnosis can be some form of maladaptive coping mechanism, which can often increase the risk of anxiety, depression, and negative emotions, which can have an impact on quality of life. When looking at eating disorders and disordered eating, despite being similar, they are not the same. And it's often overlooked how eating disorders and disordered eating are associated with mental health. So eating disorders is a mental health condition where an individual uses food as a coping mechanism to gain a sense of control around their feelings or situations they are in. This can include eating too much or too little, or even obsessing over their body weight, body image, and exercising too much, which can lead to developing anorexia nervosa, bulimia, and binge eating disorder. With disordered eating, which is more associated with IBD, this is where an individual develops an unhealthy relationship with food and engages in abnormal eating patterns or behaviors, such as avoiding a type of food or food groups, sticking to certain times they are allowed to eat, or regularly going on diets to try and manage their symptoms. However, malnutrition can occur due to the emotional and mental attitudes of an individual with IBD towards foods. Those with IBD can develop disordered eating and are more likely to develop avoidant restrictive food intake disorder. This is categorized as disordered eating and not an eating disorder because perceptions about body image and shape are not involved. Rather, it involves the avoidance and or restriction of certain foods due to the association of a negative experience such as experiencing pain. Food aversions are common and are often learned behaviors, which can arise due to several reasons, but mainly due to the association of that food, smell, texture, or taste with an unpleasant experience or memory. When these aversions occur in those with IBD, it can cause the subconscious labeling of foods and food groups into safe or trigger foods due to the feelings they initiate in that person. Another overlooked issue in those with IBD and mental health is post-traumatic stress disorder. PTSD is commonly associated with those in the military. However, it's a mental disorder that may arise after the repeated and prolonged exposure to extremely frightening or disturbing trauma. This increases the risk of poor mental health and makes suffering with anxiety and depression more likely, which can also impact on an individual's physical health. The PTSD seen in IBD is an internal factor where people are unable to escape from their encounters with IBD due to the repeated triggering of emotions that occur whenever they experience symptoms, have a flare-up, or attend hospital appointments and associate these with the negative experience they've had in the past. The level of PTSD experience will vary between each person and on how severe their IBD was at the time and what events occurred because of it. For example, having emergency surgery or having multiple invasive procedures can form a foundation for PTSD. One aspect of mental health that is often overlooked, along with many of the other things we've discussed, is sleep. So there have been several studies conducted that have shown the importance of sleep in human health. In people with IBD, sleep can be one way of managing fatigue. However, a common occurrence in people with IBD is the repeated difficulty with instigating, maintaining, and the consolidation of sleep, which is known as insomnia, which impacts the quality and quantity of sleep obtained. Those with IBD can find it difficult to get good quality sleep due to disturbances from being in pain, anxiety that they may soil the bed if they do not use the toilets at night, as well as needing to use the toilet constantly throughout the night. Several studies have shown that insomnia can increase the risk of anxiety and depression due to sleep deprivation. And the link between poor sleep and IBD is not yet fully understood, but it is thought that sleep deprivation can increase the amount of inflammatory substances within the body, which can increase the risk of having inflammatory cascades being activated, leading to flare-ups. So to summarize, we've looked at the impacts of mental health in IBD, which includes anxiety, depression, body image, self-blame, disordered eating, PTSD, and sleep disturbances.